Chapter 20: Promoting Asepsis and Preventing Infection. Disclosure: this material is for educational purposes only. I do not own any of this material. This material is not intended for medical advice. So, infection. What is infection? Well, according to your book, F.A. Davis, infection is invasion of and multiplication in the body by a pathogen, a microorganism capable of causing disease. A grasp of the broad concept of infection will enable you to promote biological safety for your patients using infection prevention and control activities. Those activities include medical and surgical asepsis and interventions to support patients' body defenses. The spread of infection, the 6 links. So first of all, we're going to start out with infectious agents. So if you look at the chain to your right, the little diagram, infectious agents are flora. It can be classified as transient flora, which are normal microbes that a person picks up by coming in contact with objects or another person. So for example, when you touch a soil dressing, you can remove these with hand washing. Resident flora, which is another type of flora, is they live deep in the skin layers, where they live and multiply harmlessly. They are permanent inhabitants of the skin and cannot usually be removed with routine hand washing. They are not usually harmful unless they enter the deep tissues, for example, as through an open wound, or unless the patient is especially vulnerable to disease. So pathogens. Pathogens also as well fall under infectious agents. These microorganisms are capable of causing disease. The largest group of pathogenic microorganisms are bacteria, viruses, and fungi, which include yeast and molds. Less common pathogens are protozoa, helminths, commonly called worms, and prions, which are infectious protein particles that cause certain neurological diseases. Okay, so once again, infectious agents can be classified as just MRSA, can be classified as C. diff, anything that anything that is living, microorganism that can cause harm or go into a reservoir. So what is a reservoir? So this is a source of infection, a place where pathogens survive and multiply. The human body is the most common reservoir for pathogens. Animals, insects, and humans are other living reservoirs. Non-living reservoirs include soil, water, food, and environmental surfaces. So as you remember in the video that we played, was it Mr. Smith or Mr. Brown? I can't remember the name of the patient right now, but the patient would have been the reservoir. The infectious agent was the MRSA. So you can actually see how the chain, how we're working on that chain at the moment, okay? Next on that link of infection is the portal of exit. So the portal of exit, in the case of human or animal reservoirs, the most frequent portal of exit is through body fluid, including blood, mucus, saliva, breast milk, urine, feces, vomit, semen, or other secretions. Okay? So the portal of exit for MRSA, in the case of that patient, could have been through maybe just he had a wound that was oozing, or if he had, if he was bloody or whatever, anything that was coming out could have been out of him, could have been the portal of exit for that pathogen, which was the MRSA. So next on the link is going to be the mode of transmission. This could be through direct or indirect contact. Direct an example could be touching, kissing, and sexual contact. Indirect contact would be contact through a contaminant object that transfers the pathogen. So for example, in class I told you, like for example, if somebody comes into and types in the keyboard with infected hands, you just touched a patient with C. diff with your bare hands, you come in and type on the keyboard and somebody else comes in and types something else, that's indirect, right? It could also be through droplet. This is passed through when the pathogens travels in water droplets expelled as an infected person exhales, coughs, sneezes, or talks. It may also occur during suctioning and oral care. The usual method of transmission is for a droplet to be inhaled or entered through the eye of a susceptible person. So with droplet precautions, remember this is going to be for a patient who has pertussis, the flu, and you want to make sure that you wear a surgical mask in the case where if the patient is just causing droplets that you can actually see visible, wear what's it called, the shield or goggles. Once again, the CDC they only require for you to put on your mask, the surgical mask. Airborne pathogens can travel through heating and air conditioning systems to infect large numbers of people. That's why with tuberculosis, which is airborne precautions, you need to have a negative pressure room, right? That way other people do not get infected through the conditioning systems. Sweeping the floor or shaking out contaminated bed linens can stir up airborne microorganisms and launch them on air currents. Imagine a flying magic carpet of pathogens. The agents of measles and tuberculosis, as well as many fungal infections, are commonly transmitted through this matter. Okay, so once again, airborne measles, tuberculosis, varicella, which is chickenpox, are airborne precautions. And for airborne precautions, you gotta remember that you have to wear an N95 or an approved filtered mask system. Next is going to be the portal of entry on the link of infection. The portal of entry could be eye, nares, mouth, vagina, cuts, scrapes, wounds, surgical sites, or IV drainage tube sites. In the case of our video that we watched in class, the portal of entry to the sophomore nurse student who was the patient was through the IV site that had just been taken out, right? Also, it could be a bite from a vector. Next on the link is going to be the susceptible host, which can be any person with inadequate defenses. For determining factors for how bad the infection is going to be, or the various factors I want to say can increase susceptibility to infection. Among them are the age, which is the very young or very old, compromised immune systems, as in those receiving immune suppression for organ transplants, and immune deficiency conditions such as HIV or leukemia. So the stages of infection include the incubation, prodromal, illness, decline, and convalescence. In the incubation stage, the person does not suspect that they are infected, but may be capable of infecting others. This stage may last only a day, as with the influenza virus, or as long as several months or even years, as with tuberculosis. The prodromal stage is where a person infected with a cold virus may experience a mild throat irritation. Not all infections have a prodromal stage. So, appearance of vague symptoms, such as a sore throat. The illness. Signs and symptoms are present. If a patient's immune defenses and medical treatments, if any, are ineffective, this stage can end in the death of the patient. Decline is where the number of pathogens just decline. This stage, the patient's immune defenses, along with any medical therapies, successfully reduce the number of pathogenic microbes. As a result, the signs and symptoms of the infection begin to fade. In the convalescence, tissue repair, the convalescence stage is where tissue repair begins and return to health. Next, we have classification of infections. These could be local, which we said that it's just limited to an area of the body, the region in the body, such as a urinary tract infection or a cat bite that doesn't cause it to spread to other areas. Now, systemic is where if that cat infection or the bite spreads via blood or lymphs to other regions, that's where you start beginning to see signs and symptoms of sepsis. With systemic, you're going to see positive blood cultures, you're going to see WBCs go up, you're going to also see fevers and so forth. So systemic is where, once again, it's more where your whole body begins to get infected. The classifications of infections by duration. So you have the acute, which is rapid onset of short duration. For example, the cold, a common cold. Chronic is going to be slow development, long duration, such as osteomyelitis. And latent is infection present with no discernible symptoms, such as HIV or AIDS. Okay, clicker check. A client living with AIDS develops oral hairy leukoplakia, an infection caused by the Epstein-Barr virus. The leukoplakia is considered a nosocomial infection, B, primary infection, C, systemic infection, D, secondary infection. I'm going to go ahead and let you think for a minute. And the correct answer is going to be D. The primary infection with the HIV virus causes the client to become immunocompromised, thus the development of the secondary infection. Okay, so next is going to be healthcare related infections. An infection acquired as a result of healthcare. Cost to the healthcare system is $4.5 billion per year. It's one of the leading causes of death and is preventable with the use of aseptic principles and technique. The lines of defense against infection, those are going to be primary defenses, are going to be anatomical features that limit pathogen entry, such as intact skin, mucous membranes, tears, normal flora in the gastrointestinal GI tract, normal flora in the urinary tract. So intact skin, if, for example, a burn patient comes into a hospital, one of the things that we're worried about that patient is the risk for infection, because once again, they don't have intact skin. Pathogens can easily enter into this patient and cause a systemic infection. Also, like for the mucous membranes, like when you begin to like cough or sneeze, a lot of the times this is a body's response to the body sensing either pollen or something trying to enter the mucous membranes of the nose or the mouth. Or like the tears, for example, like when you get something into your eyes, like dirt or whatever, you begin to tear up, right? So the primary defenses are going to once again be anatomical features that limit pathogen entry. Secondary defenses. These are going to be biochemical processes activated by chemicals released by pathogens, such as phagocytosis, which is the process by which phagocytes, specialized white blood cells, WBCs, engulf and destroy pathogens directly, is called phagocytosis. Phagocytic WBCs include neutrophils, monocytes, and eosinophils. Complement cascade. This is a process by which a set of blood proteins called complement triggers the release of chemicals that attack the cell membranes of pathogens, causing them to rupture. Complement also signals basophils, WBCs, to release histamine, which prompts inflammation. Inflammation. This is a process that begins when histamine and other chemicals are released either from damaged cells or from basophils being activated by complement. With inflammation, blood vessels dilate and become more permeable, which increases the blood flow of phagocytes, antimicrobial chemicals, oxygen, and nutrients to the affected area. The classic signs and symptoms of inflammation are localized warmth and erythema, redness, which develop as blood flow is increased. Fever. This is a rise in core body temperature that increases metabolism, inhibits multiplication of pathogens, and triggers specific immune responses. Believing that low-grade fevers are a necessary natural defense mechanism, many clinicians do not treat fever unless it is greater than 102 degrees Fahrenheit or 38.9 Celsius. Factors that increase the risk of infection, such as are developmental stage, breaks in the skin, illness, injury, chronic diseases, smoking, substance abuse, multiple sex partners, medications that inhibit decreased immune response, nursing medical procedures. So, as we talked in class, for example, developmental stage, some diseases affect more the young and the old, such as pertussis or the flu. Breaks in the skin, such as burn victims, illness, injury, or chronic diseases. So for COVID, if you have diabetes or hypertension or hyperlipidemia, these are just diseases that are going to increase your risk for infection or just developing not being able to fight that infection. Smoking and substance abuse, multiple sex partners. Obviously, you can get HIV, you can get herpes, and so forth. Medications that inhibit decreased immune response. We talked about, for example, neutropenic precautions in class, which is where people that come to the hospital get placed in private rooms, and you have to wear a mask because their immune response is lower. Their WBCs are lower just because of the medications that they're taking to fight off the cancer. And then obviously nursing medical procedures can be a risk for infection if proper asepsis is not taken before or during or after the procedure to take care of that patient. Factors that support host defenses. Adequate nutrition. This helps to manufacture cells of the immune system. A balanced hygiene. So important to wash hands, take a shower. It just can be sufficient to decrease skin bacterial count. Also, don't be overzealous because you can cause skin cracking. Rest and exercise are going to support defenses. Also reducing stress and immunizations. Preventing infection, implementing medical asepsis. So medical asepsis is a state of cleanliness that decreases the potential for the spread of infections, such as washing hands correctly. Promoted through maintaining a clean environment, maintaining clean hands, and following guidelines from the Centers for Disease and Control Prevention. Maintaining a clean environment can be such as cleaning spills and cleaning up dirty surfaces promptly. Like in the video, we saw that the nurse did not take action when the daughter of the patient came to the counter and put her dirty gloves on the counter, right? Action could have been taken to break the link of infection. You can also maintain a clean environment through removing pathogens, such as disinfecting, removing clutter, and consider supplies brought to the client room as contaminants. So making sure that in between patients, we clean our vital signs machine. Also, consider items from the client's home as contaminant. So anything that the client brings from the home into the hospital or to the clinical setting, consider them as contaminant. Put them in a special bag. Either, have the client throw it away or take it home and wash it correctly. Wash your hands when you arrive in the unit, when you leave the unit, before and after restroom use, before and after client contact, before and after contact with the client belongings. Wash your hands before gloving, after glove removal, before and after touching your face, before and after eating, after touching a contaminant article, when you see visible dirt on your hands. So once again, in class I told you, wash your hands before, during, and after a procedure if you need to. Hand washing guidelines. Wash for at least 15 seconds in non-surgical setting and 2 to 6 minutes in surgical settings. This is called surgical asepsis, by the way. Remove jewelry and clean beneath fingernails. Use a bactericidal solution or use water if hands are visibly soiled. Use warm water, not hot. Apply soap to wet hands. Use frictions. Rinse soap thoroughly and towel or hand dry. Clicker check. Which of the following actions violates a principle that is key to proper hand washing at the bedside? A. Washing your hands for 1 minute. B. Shaking your hands dry over the sink. C. Using warm, not very hot water. D. Using the soap provided by the agency. The correct answer is B. Shaking your hands will not completely remove the excess moisture, allowing for the reacquisition of bacteria on the area. Implementing CDC guidelines. Standard precautions. These are going to be precautions that protect healthcare workers from exposure. Decreases the transmission of pathogens. Protects clients from pathogens carried by healthcare workers. This could be washing hands, putting gloves. Okay. Contact precautions. These are going to be for pathogens that directly are spread through contact. Sources of infection such as draining wounds, secretions, and supplies that could be infected. Precautions include possible private room, clean gown and glove, disposal of contaminant items in the room, double bag linen and mark. So contact-based precautions could be MRSA, C. diff, are going to be the most common ones, okay? Airborne precautions are going to be put in place for pathogens that are spread via air currents, transmission via ventilation systems, shaking sheets, and sweeping. Precautions include same as those for contact with addition of special room, special mask, and mask for patient when transported. So it's going to be a negative pressure room. It's going to be an N95 mask. And if you need to transport that patient needs to wear a surgical mask when transported out of the room. Okay, clicker check. The client has a draining abdominal wound that has become infected. In caring for the client, the nurse will implement A. Contact precautions, B. Droplet precautions, C. No precautions, D. Airborne precautions. So, draining wound. This is going to be A. Contact precautions are used when contact with the infected drainage could lead to the transmission of the infection. Droplet precautions are those that are going to be spread via moist droplets, coughing, sneezing, touching contaminant objects. Precautions include same as those for contact, addition of mask and eye protection within 3 feet of the client. So one of the things that fall under these would be like the flu or pertussis. Okay. And protective environment. These are also called neutropenic, as I told you. This protective environment precautions protects the client from organisms used in special situations with immune-compromised client population. Precautions include room with special ventilation and air filters, no carpeting, daily wet dusting. Avoid standing water in the room, such as a humidifier. Precautions include nurse not assigned to other clients with active infection. Standard and transmission-based precautions plus mask and other personal protective equipment, PPE, to protect the patient. Implementing surgical asepsis. This includes the creation of a sterile environment, use of sterile equipment and supplies, sterilization of reusable supplies, surgical hand scrub, surgical attire, sterile gloves, sterile field, and use of sterile technique. You guys will be learning this when putting in Foley's. And this surgical asepsis is implemented, especially in the surgical settings. And once again, with Foley's, or when you guys are going to be cleaning or changing out the dressing of a central line, which you will see next semester. But for Foley's, you will get to see a surgical asepsis, okay, or implementing it. Thinking like a nurse. You are working as a nurse on a medical surgical unit. What roles might you play in the chain of infection? That is, what links might you be? Just think about this, okay? Once again, you can refer back to the video and just think about what roles might you play in the chain of infection. You could be the host, right, of infection. You can also be the cause of spreading the infection, right? The portal of exit. Or you can also be the susceptible host, right? You can get sick. So once again, in the nursing field, we just have to be very cognizant and very careful as to everything that we do to prevent infection, and also educating our patients on infection, especially, for example, on cough etiquette, right, for the flu. Okay, this is going to be all for infection. Have fun studying. If you have any questions, make sure that you reach out to me or Dr. Miller. Have a great day.